This is the start of videotape number 2. We're back on the record. The time is 1:07.
Doctor, you realize you're still under oath, is that correct?
Yes.
How long did it take you to review the Cedars-Sinai emergency room records?
Several minutes.
And did you review all of the paperwork that was on the file at the time?
Definitely ER visit. I'm not sure if there was anything else.
Did you know the physician who treated Tara at the emergency room?
No, I don't recall. I don't recall the name.
Did you ever ask Tara if she had seen other rheumatologists in the past?
I don't remember that.
You're unsure?
I'm not sure.
Did you ask Tara if she had seen pain management specialists?
I don't remember.
So it's possible?
Yes.
If she had told you that, would that appear in your notes?
Most likely.
Okay. Now, after you reviewed the records from Tara's emergency room visit at Cedars-Sinai, what did you conclude?
I believe there was a very brief visit for pain.
There was a what?
Very brief visit for pain complaint.
Okay.
That's all. It was helpful.
Did any other information in the file assist you with your diagnosis or treatment of Tara? Strike that. Did any information in the emergency room records that you reviewed at Cedars-Sinai assist you in your diagnosis or treatment of Tara?
No, I don't believe so.
Now, just so to clarify from this morning's session, you reviewed the Cedars-Sinai records after your initial visit with Tara, not beforehand, correct?
Yes.
The next sentence I want to discuss with you in Exhibit 4. It says, during the last several months, symptoms of pain have progressed to the point that patient had to come to the emergency room for pain control. Is that something you learned from Tara during her visit?
I think so.
Patient has been seen by the neurologist for intermittent pins and needle sensation in her extremities. Did you learn that from Tara?
I think so.
Did you ask Tara who the neurologist was?
I don't remember.
Did you retrieve records from the neurologist?
I believe she brought the record electroencephalogram, what the neurologist did.
So beyond what she brought to you, you did not request any additional documents. Is it accurate?
I don't recall requesting.
I'm sorry?
I don't recall requesting.
And the documents you received from Tara were a electroencephalogram report, correct?
Yes.
Anything else?
I believe there was blood work.
Lab work? Anything else?
I don't remember.
The next sentence says, workup included MRI of the brain and EEG, which were both negative. Did you learn that from Tara?
From the records she brought, yes.
So was there an MRI report?
I don't recall. That might be something she said.
So it's either from the report
Or her.
or her, And if it was from the report, it would have been paperwork she brought with her to the visit.
Yes.
Patient has been taking Norco for a month or two and reports great relief with Norco. Did you ask her the dosage?
I think I did.
And what was the dosage?
I believe it was 5.
And how do you know that? Or how do you remember that?
I don't remember exactly. I said that's my best recollection.
Is that a guess?
It's a guess.
Now, do you know how many times a patient can take Norco per day?
Vague, ambiguous, under what circumstances? Lacks foundation.
Go ahead.
The prescription is usually every 4 to 6 hours.
She has recently been given Ultraset. However, reports that it did not work for her pain. What is Ultraset?
It's a combination of Ultram and Tylenol.
And what is it used to treat?
Pain.
Did you ask Tara for the dosage of it?
I don't remember.
Do you know how long Tara had been treated with Ultraset?
No, it didn't work, so I don't think she was taking it.
Are you guessing?
Yes,
Okay.
it's somewhat in the notes. It says she reports that it did not work for her pain, so usually patients don't take it if it doesn't work.
Okay. Do you recall asking her how long she took it?
No,
No, you didn't, or no, you don't recall?
I don't recall.
Okay. Did you ask Tara who prescribed it for her?
I don't recall.
Patient has a history of anxiety and has been treated with Klonopin, 1 milligram twice a day. Did you get that information from Tara?
I believe so.
Did Tara tell you what her psychiatric diagnosis was?
No.
Did Tara use the word anxiety?
I think so.
Do you know if the Cedars-Sinai records use the word anxiety?
I don't know. I don't remember.
She has been treated previously with Lyrica, which caused dizziness, sedation, and memory loss. Is that something that Tara told you or that you pulled from the Cedars-Sinai records?
I believe she told me.
What is Lyrica?
It's a medication that is approved for fibromyalgia and frequently given to fibromyalgia patients.
And the side effects of dizziness, sedation, memory loss, are those common with it?
Those are potential side effects.
Are those common with it?
They're relatively common.
Did you ask her what dosage you took it in?
I don't recall.
Did you ask how long she took it?
Don't recall.
Did you ask who the treating physician was?
Don't recall.
Patient works as an actress and reports not being able to tolerate lyrica secondary to side effects. Her pain interferes with her activities of daily living. Did she tell you this?
Yes.
Did she tell you how it interfered with her daily life?
Well, the lyrica side effect, the memory loss, she couldn't use the medication because she had to prepare for auditions.
And she told you that?
I believe so.
Or are you guessing?
I believe so, to the best of my recollection, that she did.
Did she tell you any other examples of how it interfered with her daily living?
I don't recall.
Did you ask Tara if she reported these symptoms to her psychiatrist?
I don't remember.
Is that something you would have done? Scratch that. Is that something you would have asked her?
Could you repeat the question, please?
Yes. You said you did not recall whether you suggested to Tara that she report those symptoms of interfering with her daily living. My question was, did you ask Tara whether she reported those symptoms to her psychiatrist?
I don't remember.
You knew she was being treated by a psychiatrist after that first visit with you, correct?
I think so.
Are you unsure?
I don't remember exactly the wording, but yes.
Yes, you're sure?
Yes.
Okay. Her pain interferes with her activities of daily living. Review of Cedars-Sinai medical records reveals history of methamphetamine abuse. And you took that information from the Cedars-Sinai file?
Yes.
Did Tara also give you that information?
No.
Did you review those materials in Tara's Cedars-Sinai file as a result of your staff privileges at Cedars?
Yes.
Now, do you have a practice of attaching progress notes, of attaching relevant Cedars-Sinai notes to your progress notes for other patients, or is that not a common practice for you?
It depends how long the hospitalization was, if there's anything relevant. Sometimes we do and sometimes I don't.
So if there's something relevant in the Cedars-Sinai file, then you attach it to the progress notes?
Most of the time, not always.
Okay. But it's based on whether it's important.
Usually.
So if it's important, you try to attach it to the progress notes.
Usually.
Are there ever instances when you find something important in Cedars-Sinai file that you don't attach to progress notes?
Let me just interject, vague and ambiguous as to important. You can answer.
I myself don't attach anything. There is a file that the medical records person should be scanning. So information goes there and then it's either scanned or not.
Can you read back that answer?
Answer, I myself don't attach anything. There is a file that the medical records person should be scanning. The information goes there and then it's either scanned or not.
So does the medical records person examine the Cedars-Sinai file also?
No, they don't examine. They see the papers and they scan them, usually.
So when you look at the Cedars-Sinai file, do you print them off?
Sometimes, not always.
And do you print them off if they're important?
Sometimes.
Okay. Are there ever instances when there are important Cedars-Sinai files that you don't print off?
Possible.
When are those instances?
It's overly broad, vague and ambiguous, lacks foundation. You may answer.
I don't have any specific answer to that.
So it would be your common practice, though, if there's something important in the Cedars-Sinai file, you would review it and ask your medical records person to scan it to put it in your file at your office. Is that
Not
correct?
in the file, no.
Where would you put it?
In the electronic medical records.
In the what?
In the medical records, electronic.
Okay. So if there's something that you reviewed in the Cedars-Sinai file, it's your custom and practice to have your medical records person take that information and put it in the electronic file.
Usually.
Okay. Did you ever ask Tara about methamphetamine abuse?
At the initial visit, when we went over her health history,
You asked her about it?
I asked about the medications and the drugs, yes.
Did you specifically ask her about her methamphetamine abuse?
I don't remember. I asked her about drugs, that's for sure. We went over the questionnaire.
Well, you didn't even know about her methamphetamine abuse until after the first visit, correct?
Yes, but I asked her about drugs. I always do.
About illegal drugs? Yes?
Yes.
Do you recall, but do you have any specific recollection about asking her about methamphetamine?
No, I don't.
How would methamphetamine use affect Tara's fibromyalgia?
From my understanding, it was a remote history of methamphetamine use. There was nothing in the records or to my knowledge that she was using any drugs.
So is your understanding, based on your review of the Cedars-Sinai file, that she was not currently using methamphetamine?
Yes. She denies medication.
She denied what?
She denied using any drugs.
Now, if you look under physical examination, it says very thin female in no distress but anxious. Do you recall that?
Yes.
Was it her words or your words that she was anxious?
Those are probably mine.
I'm sorry.
Mine.
Under assessments on the next page, number 1, can you read that?
Sure. Unspecified polyarthropathy or polyarthritis, multiple sites.
Can you tell us what that means?
It means generalized joint pain.
In multiple sites, correct?
Right.
Okay. What about number 2? Can you read that?
Unspecified myalgia and myositis.
And what is that?
It's unspecified muscle pain or muscle inflammation.
So the assessments you made led you to the conclusion that your diagnosis was fibromyalgia, is that correct?
The working diagnosis was fibromyalgia, yes.
Did your working diagnosis ever change for her?
No.
Okay. Now on the previous page, you talked about Tara as having a history of psychiatric mood disorder. You obtained that information from the emergency room records, correct?
Yes.
Still under assessments. This is a 30-year-old female with underlying psychiatric mood disorder who present with severe myalgias and arthralgias consistent with fibromyalgia. I had a very long discussion with patient regarding fibromyalgia management. I strongly discourage her from the use of narcotics and recommend pool therapy and treatment with Cymbalta to be started at 30 milligrams daily and to be titrated up. Are those your words?
Yes.
I think the word is titrated up.
And when did you write that?
After the visit?
Now, did you write that up after you reviewed the Cedars records?
Probably.
Did you know that she used narcotics at the time that you saw her?
She said she was on narco.
When you said, I strongly discourage her from the use of narcotics, what narcotics are you speaking of?
Narco.
Narco. And did you explain to her why you discouraged the use of narco?
Yes,
What did you say to her?
because it's not first line of therapy.
Is that all you said?
No, I'm sure I said more.
What did you say? What else did you say?
Exercise, aquatherapy, lifestyle modifications are the primary and first line of therapy prior to any medications.
What was Tara's response when you told her?
She was very appropriate. She listened and understood.
What type of pool therapy did you recommend?
Aquatherapy?
Yes. Well, it says pool therapy here.
Yeah, it's usually aquatherapy with physical therapy.
So explain what pool therapy is.
When the patients exercise in the pool,
And that will relieve some of the pain in the joints?
it will relieve and reset their pain mechanism.
Did you prescribe Cymbalta to Tara?
Yes,
Had she ever taken Cymbalta before, to your knowledge?
not to my knowledge.
What is Cymbalta?
It's one of the antidepressants that is approved by FDA for fibromyalgia.
So you prescribed it to treat her fibromyalgia?
Yes,
What dosage did you prescribe?
30 milligrams.
Is that once per day?
Yes,
And that's an antidepressant, correct?
yes. It's from the class of antidepressants, but approved for chronic pain and fibromyalgia and low back pain.
Did you ask Tara if she was receiving any medications from her psychiatrist?
We went over it, I thought.
Did you ask her whether she was receiving any medications from her psychiatrist?
Yes,
And what did she tell you?
I believe she said she was taking Klonopin from her psychiatrist.
And in your opinion, it was appropriate for her to take Cymbalta and Klonopin at the same time, correct?
Yes,
And who was Tara's psychiatrist?
Dr. Bond?
Can you spell that?
No,
And did she tell you that during her first session?
I don't remember that.
Did you know that either from the first session or from the emergency room records?
I don't remember.
But you did know who it was within a day or so of the first session, correct?
I don't know if it's correct. It's not reflected in my notes. I
Well,
may not know the name.
well,
I
we-
knew she had a psychiatrist.
Well, would you have asked her the name of the psychiatrist as part of your initial consultation?
Probably,
Okay. That was your custom and practice to do so.
usually, not all,
And you usually followed your custom and practice.
usually.
Did you ever intentionally not follow your custom and practice to finding out the name of a psychiatrist from a patient you knew had a psychiatric disorder?
No.
Patient is given information about fibromyalgia. What information did you give her?
We have brochures from American College of Rheumatology or other sources, and so patient can get familiar and get the information, other resources.
Any other information you gave her besides those pamphlets?
I don't remember.
Cervical trigger points are injected with 20 milligrams of Depo Medrol and 10 cc's of lidocaine. Did you do that?
Yes,
And why did you do that?
because she was in severe pain.
And how did she do after the injections?
You mean subsequent visits, or?
Well, just, did you notice or did she tell you about any, how she felt after the injections?
I think she felt better.
Did she tell you that? Or are you guessing?
On the subsequent visit, she might have said it, not on the first one. The results are not immediate.
Okay. How was Tara's mood by the end of the first visit?
It was appropriate.
What does that mean?
She was listening to what I had to say, and she said she's going to follow with the recommendations.
Was she upbeat? Positive?
Positive.
I will see the patient in 2 weeks follow-up and will date you on her progress. So did you,
Counselor, can you read that again? I will see the patient.
He left out a word.
I will see the patient in 2 weeks follow-up and will
Update.
I will see the patient in 2 weeks follow-up and will update you on her progress.
Sorry.
It's okay, I misread that. Did you ask her to come back in 2 weeks?
Yes,
Why is that?
because that's the time when her blood work should be back, and she needs to be reassessed, how she did on her trigger point injections and Cymbalta.
Now, do you recall, now that we've talked about the visit, do you recall anything else that she said to you during that visit?
No,
Do you recall anything that David said during that visit?
no.
Now, at the bottom of the page below your signature, it says electronically signed by Karen Shainsky on August 9th, 2010 at 3:10 p.m. How did you cause that to be signed?
Well, that question assumes facts that she caused it, but go ahead. Yeah.
I didn't cause anything to sign. I believe the signature gets populated when someone requests the records or something.
So,
Gets printed,
I'm sorry?
or the records are printed.
Did you print the records on August 9th, 2010?
The medical records did.
So you did not.
I don't think so.
Did you ask them to print the records?
They received the request.
And was a request from you?
No, from you.
So our request caused them to do it, you didn't ask them to do it?
Yes.
Yes, you didn't?
We got the request and the records got printed.
Okay, was it at your direction?
Probably.
Okay. Did they ever print medical records and just send them out without your direction and approval?
It's possible. There is a medical record person, and occasionally, yes,
Is the medical record?
possible.
Thank you. Is the medical records person an employee of your office?
Yes.
What's that person's name?
Oh, there's been a change.
I'm sorry?
Now we don't have anyone. We have personal assistants, but we used to have specifically.
Okay, back in February of 2010, who was the medical records assistant then?
I can guess. I can't tell for sure.
Well, tell me who you recall working in that capacity then?
Please don't guess or speculate. He told you in the first session he doesn't
There,
want you.
there was a change in the medical record, so I can't tell you. I don't know.
Tell me the various names that you recall who worked in that department then.
Rashid, R-A-S-H-I-D, Leved. I don't recall her spelling.
Anyone else?
No.
So that's the only person you recall working in medical records at or about 2010.
2 people, yeah, 2 or 3 people. I don't remember.
And who are the other 2 people?
She gave you 2 names.
Leved.
Okay, and who's the third person?
I don't remember anyone else. But we do have sometimes students come in to help out with paperwork.
Do you recall Levette's last name?
No.
Okay. Now, at what point during your examination with Tara did you provide her with the prescription?
At the end of the visit.
Did you provide it to her or did some assistant provide it to her?
I think I did.
Did you discuss with her any potential side effects?
Usually I do.
What did you tell her?
Sedation. That's constipation.
Now you were prescribing for her what?
I think she got Cymbalta and she got Norco.
Now the prescription that you have attached to Exhibit 4 is a prescription for what?
Norco.
Okay. Is there a prescription for Cymbalta attached?
It's not a triplicate, so it may not have been scanned.
So there's another prescription that you gave Tara that day, which you did not make part of your progress notes?
I mean, it clearly states in the progress note the name of the medication and the dosage, but the prescription is not copied.
So the prescription for Cymbalta is not attached to your progress notes?
Yes.
That's correct. And for Norco, you prescribed Norco for her, correct?
Yes.
Now, why did you prescribe Norco for her if under your assessments you're stating that you strongly discourage her from the use of narcotics? And you mentioned when I asked you a question that you were strongly discouraging her from taking Norco.
Because she was on the pain medication and she was in severe pain. So you can't stop the medication.
So even though you strongly discouraged her from taking it, you prescribed it for her. Is that correct?
Hang on. The question is phrased as argumentative and it misstates her earlier testimony. Okay.
Hold on.
Go ahead.
You
You
may
can
answer.
answer. You can answer.
Go ahead.
Go ahead.
The recommendation at the end of the assessment was in overall management of fibromyalgia, narcotics are not the first-line therapy and should not be overused. But you cannot stop the medication if the patient has been taking it and is in severe pain today.
But that's not what you say under assessments, is it?
Well, that's
I just
argumentative.
clarified.
Hang on. That's argumentative.
Why don't you read the section and ask her?
When you write, I strongly discourage her from the use of narcotics, it doesn't say on there that you're asking her to wean her off of that. Does it say that?
It doesn't say that.
Okay. So my question to you is, why are you prescribing Norco to her when in your assessment you're stating that, quote, I strongly discourage her from the use of narcotics?
Asked and answered. Tell
So,
him again.
so you go ahead.
Yeah.
Because she was in pain.
Okay. Answer.
And what was the reason that you were strike that? were you trying to wean her off of narco?
In general, that would be the idea, yes.
Did you give her any instructions to wean her off of narco?
No.
Did you reduce the dosage of the narco she was taking from before the time she came into your office until the time you gave her new prescription?
She was in severe pain, number one. Number two, Cymbalta takes weeks to work. You cannot wean someone off the medication if they have been using it for a while, immediately.
So the answer is you were not weaning her off the narco from the time and the doses she was taking. Strike that. At the time she came into your office for the first visit, you were not weaning her off the narco, correct?
Correct.
What happened as a result of, strike that, how was Tara treated during her emergency room visit by the physicians?
I actually haven't seen the emergency room visit since that time, so I don't remember.
So you don't recall her treatment?
I know she was giving pain medications.
Do you know what she was given?
I think she was giving Norco.
Was she given anything else?
I don't remember.
Do we have the records from this? That's fine. Marking now as Exhibit 6, I believe.
Yes.
Yes, one next for you. Now, exhibit number 6 are the medical records that you reviewed on file from Cedars-Sinai when you went online, except for the cover page, the second page, and the third page. Is that correct?
I don't believe so.
So you do not believe this is the emergency room file that you reviewed, or it is?
There is only dictations on the emergency on the Cedars-Sinai that I can access, so this is some kind of scanned document. I've never seen it in this format, or...
Well, let's look at some of the information then contained in it. Let's see
Sure.
if this is some of the information that you reviewed when you accessed the file. Let's go to page 15. This is Cedars-Sinai Medical Center, ED, provider notes signed at, and then it gives a date. And the author is Zachary H. Lutsky. Do you have the page?
Yes, I do.
Okay. Do you need to look at the other pages, or?
No,
Okay. Do you know Zachary H. Lutsky?
no, not personally.
Below it, it says final verified report, patient Tara D. Rogatis. Emergency treatment record for April 12, 2009. Is that the date of Tara's emergency room visit that you reviewed the records for?
I don't remember the date of her visit to the ER.
Well, do you recall when you examined her emergency room records in February of 2010 if there was more than one emergency room visit that she had made?
I don't remember.
So you're not sure how many emergency room visits she made?
No.
Okay. Do you think if you would have discovered that she had more than one emergency room visit at Cedars-Sinai, that would be reflected in your progress notes?
Probably.
Okay. Do you believe since it's not reflected in your progress notes, that's a good indication that this April 12, 2009 visit was the only visit that you reviewed for emergency room records for Cedars?
Let me just object. It lacks foundation. Please do not guess or speculate. Go ahead.
I don't know.
In fact, if you look at the under history of present illness, some of the information there tracks some of the information in your progress report. Is that right?
It's vague. Which information? I'm sorry, vague.
Let her answer as best you can.
Yes.
So does that refresh your recollection that the information contained in the Cedars-Sinai file was some of the information you relied on when you accessed her file at Cedars-Sinai?
Again, lacks foundation. Please do not guess or speculate. Go ahead.
Your Honor?
I'm not offended by that, if you can answer that.
I don't remember how many visits she had. If you want to rephrase the question, I'll be.
No, the question was, is this some of the information you relied on when you saw her?
Yes.
So you learned that she had a psychiatric mood disorder with psychotic features from the Cedars file, correct?
Yes.
And you learned that she came to the emergency room complaining of left-sided body pain, correct?
It's not reflected in my notes, so I can't say correct. I did see the information. I don't even recall seeing this document.
That's the problem. That's the foundational problem. Yeah. Go ahead.
Thank you, counsel. Do you recall when you reviewed the file that it indicated that she had had symptoms for over a year?
Yes.
Do you recall that she ended up in the emergency room because the symptoms had gotten much worse in the last few days?
No.
Do you recall that she was experiencing what she called tactile hallucinations?
No.
You're not saying this information was not in the file, you're just saying you don't recall, is that correct?
Yes.
Okay. Do you recall reading that the symptoms had been much worse to the point that she wants to die because she cannot take it anymore?
I don't recall.
You don't recall that in there?
No.
Okay. Do you recall reading that the patient states that she took double doses of Xanax and Risperdal this evening to try to help with her symptoms?
I don't recall.
So under social history, it says the patient has a history of methamphetamine abuse. So do you recall reading that and putting it into your progress note?
I don't remember this document in general. the history of methamphetamine abuse did come from Cedar Sinai, but I don't think it was that. Or
Do you recall reading that the past medical history stated that she had mood disorder, hallucinations, and hypothyroidism?
yes, I don't recall hallucinations, but it says that.
Under Emergency Department Course, Treatment and Discussion, on page 16 near the top, the patient felt that her symptoms are not psychiatric, and I told her I would check with some basic blood work on her. These studies came back normal. After the psychiatric resident saw the patient, I asked to give her some Benadryl, Toradol, and then some Ativan and Seroquel. Do you recall reviewing that in the records?
I don't remember that.
Do you recall under the disposition, scratch that, do you recall when you reviewed the notes it contained a diagnosis?
Chronic pain.
I'm sorry?
Chronic pain?
Well, do you recall that it contained a diagnosis?
I don't recall.
Do you recall that it contained a disposition?
I don't recall.
Do you recall looking at the blood tests that were undertaken?
The question assumes she had access to the blood test, but lacks foundation.
You can
I don't
answer.
recall.
You had access to lab work, correct?
I can show you if I had Cedars Terminal what exactly I had access to. It's
When you-
dictated medical records usually, and some of the blood work.
Okay. So there was some blood work in the medical records that you reviewed, correct?
Yes.
Now, would it be fair to say that the information contained in Exhibit 6, in terms of the history of the HPI, as you called it, was something that you reviewed from the Cedars-Sinai records, even though it was not necessarily in the format of Exhibit 6?
The question is phrased as overly broad and vague as to what's in the history. I think she's agreed with part.
You've stated your objection.
Yeah. Do you
Is
understand
it-
the question?
Do you need it read back?
Yeah, can you please?
Can you please read it back?
Now, would it be fair to say that the information contained in Exhibit 6, in terms of the history, or HPI as you called it, was something that you reviewed from the Cedars-Sinai records, even though it was not necessarily in the format of Exhibit 6?
Again, it lacks foundation.
I understand.
Yeah.
Can you answer that?
Probably. Yeah.
Okay.
He's asking you
And-
to...
Wait,
Hang on,
just-
hang on.
She's answering.
Don't tell her what he asked her. It's okay.
Okay.
Whether it's in this document or whether she says that's what she remembers.
Okay.
I don't know how many ER visits she had. I remember seeing one ER visit, and if that's what's the one,
You've told him. Go ahead.
Thank you. Now, Exhibit 5, do you have that before you?
yes.
Can you show me where in your letter to Dr. Rahman you disclosed that you were prescribing Cymbalta?
In the assessment and plan,
Can you read it? Out loud.
I strongly discourage her from the use of narcotics and recommend pool therapy
Slow down. Go
and
ahead.
treatment with Cymbalta to be started at 30 milligrams daily and to be titrated up.
Okay. And can you show me where in your letter to Dr. Rahman you prescribed her Norco?
It doesn't say that.
Why not?
It just did not get there.
So you don't have a prescription attached to the progress reports, and it's not mentioned in your letter to Dr. Rahman. Can you think of any reason why that's the case?
Let me just object that your statement misstates the evidence. It is mentioned in the first page of the letter to Dr. Rahman.
Go ahead.
I have nothing else to add.
Okay. Under medications on the first page where it says Norco, those are the current medications, correct?
Yes.
That doesn't mean that's what you're prescribing to her in the future, correct?
It doesn't.
Okay. Now, if you look at your progress notes, the last page,
Which exhibit?
how
please?
long?
Which exhibit?
Exhibit
we were
4.
on 5, and now we're on a different document.
Exhibit 4.
Okay.
If you look at the last page, it shows that you prescribed to her 60 pills, is that correct?
Yes.
And how often should she take those pills? Or how often did you prescribe that she take them?
Every 6 hours as needed for pain.
So is that one tablet every 6 hours?
It says 1 to 2
So 1 to 2 every 6 hours, correct?
as needed for pain.
What was she taking, what was the amount of Norco she was taking before that? Was that the same amount? A different amount?
I think it was the same amount.
You would not have prescribed a stronger prescription, correct?
No, not necessarily correct.
So it's possible that you would have increased her prescription of Norco?
Probably not, but I don't have your old prescription, so I can't give you a very accurate answer. I think it's what she was using before.
And what does it mean, Norco 5/325?
The second number is the Tylenol, amount of Tylenol in Norco.
And the first number?
It's the actual Norco.
Did you believe that Tara had a history of psychosis at the time that you finished reading the records from Cedars-Sinai?
No.
Did you believe that Tara had psychiatric symptoms by the time you finished reading the Cedars-Sinai records?
You're talking about in April of 2009? I'm sorry, vague as the time.
Did you review the Cedars-Sinai records more than one time?
No.
Okay. So in February of 2010, after you reviewed the Cedars-Sinai records, did you believe that Tara had psychiatric symptoms?
Anxiety symptoms.
I'm sorry?
Anxiety symptoms.
No, I said psychiatric symptoms.
Well, it may be vague.
What?
I don't know how to interpret psychiatric symptoms.
Okay. If someone's, for example, saying They have psychiatric mood disorders, psychotic features, tactile hallucinations. They want to die because they can't take the pain anymore. Mood disorder and hallucinations. Would it be fair to say that those are psychiatric symptoms?
They could be psychiatric symptoms. Panic attack, anxiety can cause all of those.
I didn't mention panic attack. I just mentioned certain items. The ones I mentioned to you, are those indications of psychiatric symptoms?
Hold on. Argumentative. Whether you mentioned it or not, she told you that was a possible cause.
Well, just a
She
minute, just a second, wait,
misinterpreted her
stop,
answer, Your Honor.
excuse me, stop. It's just a question.
But it's
And
a
if
question without foundation. And he's
Excuse
building
me.
into his question.
Pardon me, he's listed some symptoms, ask her if they're psychiatric. If she thinks they are, she can say yes.
They
If she
might
thinks
be
they're not, she can
psychiatric.
no.
One person.
And if she doesn't, she can say no. It's very simple.
But she answered it, Your Honor.
He added one, she added something,
Can
which
you read
wasn't
back
in the
the
question.
Can you read back the question, please?
Question. I didn't mention panic attack. I just mentioned certain items. The ones I mentioned to you, are those indications of psychiatric symptoms?
They could be.
At the time, did you believe them to be?
No, she certainly did not act as a psychiatric patient. She acted very appropriately.
Do you know what psychosis is?
Yes,
What is that?
I can't give you a definition.
Tell me generally what it is.
I can't define it.
Well, I'm not asking for a definition, just explain it in your own words. It doesn't have to be a dictionary
I can't
definition.
explain it and define it.
Doesn't have to be a dictionary?
Doesn't have to be a dictionary definition.
And you said I can't explain it or define it?
Yes.
Do you have any idea what a psychosis is?
Yes.
What is it?
I cannot answer that question
Because why?
because I can't answer the question.
Is it because you do not know what a psychosis is?
I can't give you an exact definition, and every word I'm going to tell you, you're going to question, so I cannot answer that question.
That's not a basis for you not answering a question.
It's a very general question. I can't answer it.
It is a general question. What is your understanding of what a psychosis is?
Vague, ambiguous,
Okay.
lacks foundation. Go ahead. I think she's already answered, Your Honor.
Well, she said she can't answer, so.
Well, she said it's a
It's
very vague
too-
question.
Go ahead.
It's too general of a question, and I can't answer it.
So if a patient comes to you and says, "Doctor, I have a psychosis," what do you understand that to mean?
No.
Or do you not understand what a psychosis
It's a
is?
general, very general description. No, it's not specific.
So, but what do you understand it to mean? If a patient comes to you and says, "Doctor, I have a psychosis," or another doctor says, "I'm referring to a patient and one of the symptoms is this person has a psychosis." As a physician, what do you understand that to mean?
Those patients usually diagnosed with some illness. It's either bipolar disorder, anxiety, or some other specific psychiatric diagnosis. Psychosis is not a specific psychiatric diagnosis.
So it's a generalized diagnosis.
Yes.
And it could be being bipolar, it could be anxiety, or it could be something else.
Yes.
Now, as a physician, have you heard people or patients come in and tell you before they feel pins and needles sensations in their extremities?
Yes.
Okay. So that's not an uncommon symptom?
No.
Have you ever had patients who suffered psychosis?
A vague and ambiguous lacks foundation. Go ahead.
Yes, and training.
I'm sorry?
Yes,
In training. Have you had them during your practice?
yes,
Okay. The ones you've had during your practice, do they often describe some of the pain they feel as pins and needles sensation?
going back to pins and needles, many patients without any psychiatric illnesses can have pins and needle sensation from nerve impingement, and we see it frequently in rheumatology.
And my question's a little different. My question to you is, are you aware of patients who suffer psychosis often describe pins and needle sensation as a symptom?
It's possible,
Do you see that in your practice?
yes.
Do you know what a differential diagnosis is?
Yes,
I'm sorry?
yes.
What is that?
It's several working diagnoses that are included.
Let's mark as the next exhibit in order, number 7.
Thank you.
Exhibit 7 is a 3-page document, Bates number 010 through 012, and appears to be progress notes from you involving Tara de Rogatis, dated March 1st, 2010. Is that an accurate description of that document?
Yes,
Have you had an opportunity to review this before coming in today?
I've looked over it.
Do you need some more time to review it?
No,
These progress notes recount Tara's second visit to you, correct?
yes,
And her second visit to you occurred approximately 21 or 22 days after her first visit. Is that right?
yes,
So that was within about the time period you asked her to come back, correct?
yes,
Now, by this time, you had already received the lab reports.
yes,
Do you follow the same procedure in preparing these March 1, 2010 progress notes that you did for the first one? That is, did you input information during your examination of Tara from a laptop?
Usually some of the things are carried over from the previous notes, but they're additions, yes.
So when you see Tara, when you saw Tara for a second time, you had progress notes dated March 1st, 2010, and the history of present illness field was already populated, and it was there for you to make any changes as necessary.
Or add,
What changes?
yes,
Changes meaning take away or add to,
yes,
correct?
yes,
Is that true for the vital signs section
yes,
and the physical examination section
yeah, yes,
and the remaining part of the notes?
yes,
Okay. Now, under current medications, you asked Tara what she was taking when she came in, and this is what she told you?
yes.
And the only thing that's new on this from the first progress report is the prescription of Cymbalta 30 milligrams, 1 capsule twice a day, correct?
Yes,
And that's what you prescribed to her?
yes.
Okay. So under the history of present illness, that first full paragraph is the same as the first full paragraph in the progress notes exhibit 4, correct?
Yes.
Okay. Then the next paragraph says, patient reports great improvement in pain with trigger point injections but lasted only 2 weeks. That is something you added during this visit, correct? Yes?
Yes.
So during this visit, do you recall if David accompanied her? Strike that. Did David accompany her during the second visit?
I don't believe so.
Do you recall anything else that Tara told you during the second visit besides that there was great improvement in pain with trigger point injections, but it only lasted 2 weeks?
She also reported stress at home, financial stress at home.
Okay. What else? Did she report to you that she was now in pain?
Yes,
Okay. And that pain was diffuse?
yes.
What else did she tell you besides there was stress at home?
That she had to, they were in the process of moving out of the house.
Okay. And that she could not afford it?
Yes.
Okay. Do you recall anything else she told you during that visit?
No.
Did she describe her pain to you in any other way besides it being diffuse?
I don't believe so.
Did she tell you anything more about the stress at home besides it dealt with her moving out of the house that they could not afford?
That's all I recall.
Down at the bottom under assessments, do you see that?
Yes.
You have the same first assessment, correct, as under the
Yes.
Exhibit 4. And the second assessment is the same except you're increasing now the Cymbalta from 30 milligrams to 60 milligrams daily, correct?
Yes.
Why were you increasing the Cymbalta?
Because that's the standard of care. You start with a low dose and you increase it for a full effect, if the patient is tolerating it.
Did you have a goal of increasing it to a certain amount?
The goal was to control the pain better, and hopefully she would have to take less of short-term pain medications. That was the overall goal.
Did you consult with her psychiatrist before increasing her dosage of Cymbalta?
I don't remember that.
Would that be in your notes if you did?
It could be.
Do you see them anywhere in your notes that you consulted with her psychiatrist before increasing it?
No.
That would have been an important fact that you likely would have included in your notes. Is that correct?
Probably.
And the fact that it's not present in your notes leads you to believe that you likely did not consult with her psychiatrist before increasing it. Is that correct?
I only do it if there is an indication, meaning the patients are taking other antidepressants from other physicians and she wasn't.
But wasn't she taking Klonopin?
Yeah, but it's a short-acting anti-anxiety medication. It's not an antidepressant.
So Klonopin is not an antidepressant.
No.
So you did not believe it was necessary to consult with their psychiatrist before increasing it to 60 milligrams, is that correct?
Yes.
Did you inquire whether Tara was undergoing pool therapy?
I don't remember that.
Did you provide her with any suggestions or referrals to places that undertake pool therapy?
I think so. I don't remember it.
Did you have the blood work back from the first workup?
Yes.
And what did the blood work reveal?
I believe her ANA panel was negative and her SED rate was low.
What was low?
SED rate?
Did you give her another set of injections?
Yes.
Trigger point injections?
Yes.
Was this essentially the same procedure that you followed in the first visit?
Yes.
Do you recall giving Tara any other advice during that second visit?
I don't remember.
If you look on the top of the third page of Exhibit
7.
Exhibit 7, it says, this is a 30-year-old female with underlying psychiatric mood disorder who present with severe myalgias and arthralgias consistent with fibromyalgia. That is the same language as in the first report, correct?
Yes.
Then the next next couple of sentences are the same too, correct? I had a very long discussion with the patient regarding fibromyalgia management. I strongly discourage her from the use of narcotics and recommend pool therapy and treatment with Cymbalta. You just left that from the first report, correct?
Yeah, it was carried over.
Patient is given information about fibromyalgia, cervical trigger points are injected. That sentence is the same too, correct?
Yes.
I will see the patient in 2 weeks follow-up and will update you on her progress. Now, down below it says the follow-up is 4 weeks. Was that just a mistake? That wasn't changed? From 2 weeks to 4 weeks?
No, I think it meant to be 3 to 4 weeks, and the previous sentence was carried over.
So how many weeks did you want to see her? How long did you want to do a follow-up in?
3 to 4 weeks.
So when it says in the paragraph 2 weeks, and down below it says 4 weeks, what's your recollection of when you told her to come back?
The 2 weeks was carried over from the previous visit,
Okay.
so we usually see the patient in the first follow-up after 2 weeks from the initial consultation, usually.
Did you send Dr. Rahman a letter after the second visit with Tara?
I don't remember.
Is it your practice to do so?
Usually only initial visit.
So most likely you did not send the doctor a letter containing the information you received from Tara during her second visit?
Probably.
If you turn to the last page of Exhibit 7, did you give her another prescription?
Yes,
What did you give her a prescription for?
for Norco.
And this is the same drug that you're stating in your assessment that you were strongly discouraging her from using, correct?
Yes.
Now, how does this prescription of Norco differ from the first one?
The first one was 5 milligrams and it was 1 to 2 pills, and this one is 10 and it's 1 pill.
Okay, so is this stronger than the first prescription?
One pill is stronger. The amount of medication she was taking is the same.
Okay, so you're increasing the strength of her Norco, is that correct?
Objection misstates her testimony. Go ahead and explain it.
So the one pill is stronger, but she is not supposed to take more than one at a time.
Okay, and how many did you prescribe for her? How frequently would she take them?
She would take it every 6 hours as needed for pain.
1 to 2 pills?
One.
1 pill, okay. And how many pills did you prescribe for her?
100.
So you increased the dosage.
I'm sorry, objection
The
You-
quantity, it's the dosage is different.
Right, you increased the quantity, is that correct?
I'm sorry, with all due respect to His Honor, the dosage is not different. The dosage he was
I
taking...
didn't say it was.
Okay.
The quantity of pills is different. There's a difference between
Right.
dosage and quantity.
Right.
Let's hear what the doctor has to say. Doctor, you increased the quantity of the pills, correct?
Yes.
So you increased it from 60 to 100, is that right?
Yes, because she was given a further follow-up,
I'm sorry.
not in 2 weeks.
Given what?
A follow-up in 3 to 4 weeks, not 2.
So she needed more pills to last her.
Yes. Plus, she reported additional stress at home that frequently causes fibromyalgia flare.
So in any 24-hour period, how many pills should Tara take?
She should only take it as needed for pain.
But let's say she had pain all the time.
So 4,
So 4 per day
yes.
or 28 per week, is that right?
Yes.
Is that a lot to take?
Vague and ambiguous for under what circumstances?
Under the circumstances you met Tara de Rogatis.
It's a fair amount of pain medications.
But is it a lot?
It's vague a lot, but go ahead.
You can answer.
It's a fair amount of medications. I've seen patients taking more, less.
Okay. So you don't view this as a large quantity for her to take in a 1 week period,
That's
28?
the same question you've asked now 3 times. Objection, harassing. You can answer it again the same way.
All right, just,
Instructing your witness to answer a question the same way counts is not
Yeah.
appropriate.
Well,
just
asking the same
please, let's
question
not
3
get into
times.
this. The objection is noted, your comments are noted. Just answer the question again.
It's a fair amount of medications to take, but patient was under a lot of stress at home, and she was in severe pain, and you have to treat the pain when you treat the patient.
So for a patient to take 28 per week or over the course of 4 weeks, 100 pills, would you consider that a fair amount?
It is a fair amount,
Not excessive, correct?
not excessive.
Would it be fair to say that a patient who needs to take 100 of these tablets in a 4-week period of time because they have chronic pain has a severe pain issue?
Yes.
Can you show us where in your progress notes, Exhibit 4, that you indicated you increased the dosage and the quantity of the Norco?
I think you misspoke. I think you meant Exhibit 7. If you wanted to go back to Exhibit 4, we can do that.
Exhibit 7.
Within assessment and plan, it doesn't say that. There is a copy of the prescription that says it.
My question to you is, within the progress notes, is there anywhere that you indicate that you have increased both the quantity as well as the dosage of the Norco?
I did not increase the dosage of the Norco. It's the quantity of the pills because the follow-up was farther away.
Do you see it anywhere in your progress notes?
See what? Vague. See what?
Your narco prescription.
It's attached to the file.
Quite was in the notes. It's not in there.
Not in
Thank
the
you.
notes.
Thank you. Did you ask her, Tara, how she was reacting to the narco?
It helped her with pain.
Did she tell you anything else about the narco?
No.
Did she tell you how she was reacting to the Cymbalta?
The overall treatment seemed to be working. She said she was feeling a lot better for 2 weeks after the initial consultation.
Did you ask her if there were any side effects?
Yes.
What did she tell you?
I don't remember, but she didn't have anything significant, otherwise it would be reflected.
What are some of the general side effects of Cymbalta?
Nausea.
Nausea? Anything else?
It's individual. The most frequent is nausea.
Does the manufacturer notify what some of the common side effects are?
Yes.
And have you read what the side effects are according to the manufacturer?
Let me just object on relevance. Go ahead, you can answer that.
Yes.
And besides nausea, is there anything else?
Excessive sleepiness,
Anything else?
vomiting,
Anything else?
constipation, abdominal pain.
Are suicidal ideations one of them?
I believe most of the medications, antidepressant, can have it, but I don't recall that.
So you're not sure if suicidal tendencies are a possible side effect of Cymbalta, correct?
I misstates earlier testimony. Go ahead, doctor.
No,
You don't
I
recall?
don't recall.
Okay. How much time did you spend with Tara during the second visit on March 1st, 2010?
Probably 15, 20 minutes.
Did you order any blood work this second time around?
I don't believe so.
I think it's time we took a couple of minutes. It's 2:30 now.
Perfect.
Off the record, 2:30.
I hope I don't say anything.
Back
Keep
on the
forgetting
record.
this.
Oh, okay.
Back on the record, 2:42.
Thank you. Dr. Shainsky, you know you're still under oath, is that correct?
Yes.
Okay, marking as next in order.
8.
Is a one-page document. Page number 19. It's from the UCLA Neurology and Rehabilitation Medical Group. It's dated March 2nd, 2009. And the patient is Tara D. Rogatis. Could you take a moment and review that?
Yes,
Have you seen this before?
I believe so.
Was this one of the documents that Tara provided to you during her first visit?
Yes.
Did this come from your file?
I believe so.
When patients bring you documents from other physicians, is it your practice to keep copies of those materials?
Yes.
And did you review this document when she provided it to you?
Yes.
Was there any information from this document that you found helpful in your diagnosis or treatment of Tara?
Yes.
What was on there that you found helpful?
She was seen by the neurologist and had an electroencephalogram that did
And what?
EEG that was normal.
Anything else?
No.
In the first paragraph, can you please read that?
This tracing is performed on a 29-year-old female referred in by psychiatry because of altered memory and auditory hallucinations following a significant head injury several years ago.
So is it possible, do you know if it's possible to have altered memory and auditory hallucinations from a head injury?
It's possible.
Is it your understanding that the reason for this test was to rule out a physiological reason for altered memory and auditory hallucinations she was experiencing?
Objection lacks foundation. Do not guess or speculate.
You can answer.
I don't know exactly what their thinking was.
Did you ask Tara about her auditory hallucinations?
She did not complain to me about any.
Did you ask her if she was still experiencing them?
I don't remember that.
Did you ask her if she was experiencing altered memory?
She blamed it on Lyrica. That's the reference I remember.
So during any of the 3 visits, did you ask her if she was still experiencing the altered memory and auditory hallucinations which caused her to receive an EEG back in March of 2009?
That question's compound, this phrase, but you can answer it if you understand.
She never mentioned any hallucinations to me.
And after you reviewed this report, you understood she had experienced hallucinations, correct?
In the past, yes.
Did you ask her if she was experiencing them currently?
I'm sure I asked.
Well, this EEG report seems to indicate that she possibly has psychiatric issues, correct?
Again, lacks foundation. She didn't author this report. It will put her in a position of speculating. Do not guess or speculate.
I don't know exactly.
Well, doctor, based on your experience, if psychiatry is recommending an EEG to rule out altered memory and auditory hallucinations, and they find no indication of any injury, and in fact find normal EEG results, would that be an indication that there possibly are psychiatric issues present?
Let me just object. It lacks foundation. The question is phrased as medically unintelligible.
Well, look, if she can understand it and answer it, she can answer it. The speaking objection is overruled.
Okay, go ahead. Go ahead. Do you understand what he's asking?
Not exactly.
Fine. But, please, 2-word objections are sufficient. Mr. Brown's objection is that you're sending your signals to
That's exactly what it
how to
is.
answer the question. So please just state the objection. They're all preserved except privilege, so there's no need to delineate them and define them. And if she can't answer a question, she's not going to do it.
Lax foundation, medically unintelligible as phrased.
Okay, and she's already answered. She said she can't.
After you read this EEG report and you read the Cedars-Sinai file, you had indications that there were some psychiatric and psychological issues with Tara, correct?
Vaguest of time. Go ahead.
Yes.
I thought I had two. Apparently. Oh, let me go get it. Marking is next in order. Oh. Did this include? See, it doesn't include this includes prescription. Here, why don't you go to your mouth? It's all right here. We're going to take a moment and grab a couple, excuse me, additional documents. It just should be a minute or so. Okay, marking is next in order is exhibit number 9. Exhibit number 9 is a 4-page document base numbered 013 through 016. They are the progress notes for Dr. Shainsky, dated March 22nd, 2010. Doctor, is my description accurate?
Yes.
Now, the third time you saw, do you need a moment to review the notes?
No.
The third time you saw Tara in your office was on March 22nd, 2010, is that right?
Yes.
And that was approximately 3 weeks after your second visit with her, correct?
Yeah.
Now, was David present during this visit?
Yes.
During this visit, how long did it last?
I don't remember exactly, but
Do you remember approximately?
30 minutes, 40 minutes, I'm not sure.
If you look at the bottom of the second page, second line from the bottom, what does that say?
Spent more than 40 minutes.
So does that refresh your recollection that you spent more than 40 minutes with her?
Yes,
And with David?
yes.
And David was present during the entire time, correct?
I believe so.
Did you follow the same procedure in completing these progress notes as you did for the first two? That is, did you fill them out contemporaneously on your laptop?
Yes,
And did you have the fields for reason of appointment, current medications, history of present illness, etc., populated from the second visit?
yes,
And you just went in and simply made whatever changes, additions, subtractions as needed based on the information you were provided during the third visit?
yes.
Okay. How did Tara look to you that day?
She was anxious. She was saying that she was in pain and she's anticipating surgery.
So she was anxious. Now, she was anxious the first two visits, correct?
Yeah.
Okay. So did her anxiety differ in degree at all from the first two visits?
She might be a little more anxious because she was talking about surgery.
Did she at all appear to be disheveled?
Not disheveled.
Okay. Not dressed well?
What does it mean?
Maybe wearing clothes that were sloppy or unkempt?
Sure. Casual clothes, not dressy clothes.
Nothing that,
Sweatpants or, you know.
nothing that you noticed out of the ordinary?
No.
So when you walked into the room, do you recall what you said to Tara and what she said to you?
No.
Do you recall anything you said to Tara?
No, I don't remember.
Do you recall anything that Tara said to you?
She came because she was in pain and she was running out of medications and she was in pain and she was running out of her medications and she was concerned about pain after the surgery.
Anything else she told you?
Nothing initially, no.
What about during the examination? Other than what you've already told us, what else did Tara tell you?
She mentioned that her plastic surgeon or her anesthesiologist, I don't remember which one, recommended her to stop her antidepressant medications.
Is that the Cymbalta?
Yes,
Yes?
yes.
Now you say it was either the plastic surgeon or who else?
Anesthesiologist.
Anesthesiologist, okay. What else did she tell you?
That's all I remember.
When she told you that the plastic surgeon or the anesthesiologist recommended that she stop taking her antidepressant medication, which needed to be Cymbalta, what did you tell her?
I said that I asked her, I believe, if her psychiatrist is aware of it.
You asked her if her psychiatrist is aware of what?
That she needs to stop the medications or she already stopped.
So you asked her if her psychiatrist was aware that either the plastic surgeon or the anesthesiologist had recommended that she stop the antidepressant before her surgery?
Yes.
And what did she say?
I I think she did not see her psychiatrist. I don't remember what she said.
You don't recall her response?
No.
Now, was it you or was it the psychiatrist who prescribed the Cymbalta?
I prescribed the Cymbalta.
Did you tell her that she should continue taking the Cymbalta, or did you tell her she should discontinue it?
I told her she should not stop on the antidepressant abruptly without the input from her psychiatrist.
Did she tell you whether she had already ceased taking the medication?
I don't remember.
Did she tell you when her surgery would be?
I don't know the exact day. I think it was towards the end of the week. Actually, David mentioned that, I believe.
Did she tell you what type of surgery she was undergoing?
She did not go into details. It was cosmetic surgery.
Cosmetic, okay. Did you ask any further questions about her surgery?
I've asked, yeah,
You asked her? What did you ask her?
what kind of surgery, and she said cosmetic. She did not go into details.
When you said she told you during her visit she had pain when she came in, did she describe her pain for you?
Yes, she said she was in severe diffuse pain.
Were those the words she used?
I can't tell you exactly if she used those words, but
Did she use the word diffused?
I don't remember.
Did she use the word severe?
Pretty sure.
Now, she had seen you 3 weeks earlier, so 21 days. Was she out of her medication of Norco by the time she visited you, to your knowledge?
I don't know exactly.
Do you
Most
recall?
likely, yes.
I'm sorry?
I think so, but I don't have.
Do you recall if when she visited you, she brought with her bottles of medication?
I think the last visit she might have brought the medication.
When you say the last visit, are you talking about the March 22nd
Yeah,
visit?
this one.
Okay. So you do recall her bringing to the office visit the various bottles of medication she was taking?
I believe so.
And do you recall if one of them was the Norco?
I think so.
Do you recall looking at the various bottles?
I can't remember.
Well, you would want to look at the various bottles to look at the types of medication that she is taking as part of your examination of her, correct?
Yes.
So it's likely then that you looked at the various bottles of medication she presented to you.
Yes.
Do you recall whether she had any Norco remaining when you looked at the bottle?
I think if there was any, it was a couple pills. She was out of the medication.
If there were only a couple of pills, would that be an indication to you that she is taking more pills than you prescribed to her?
So it's been 3 weeks.
Yes.
So technically, no.
So you believe that she should have run out by 3 weeks,
She could have run out if she was taking them every 6 hours.
as you ordered, correct? Okay.
Yeah.
Is that a yes?
Yes.
Okay. What did she say to you about being worried about pain after her surgery?
That she is in a lot of pain now, and she anticipated more pain post-operatively, so she was concerned.
What did you say in response?
That there will be a pain management and involved after the surgery, and they should help to manage the pain.
So you told her that the plastic surgeon or the anesthesiologist would take care of that pain?
They should help with that pain, yes.
And you told her that?
Yes.
Okay. Now, did she tell you whether or not she'd increased her dosage of Cymbalta to 60 milligrams twice a day?
I don't recall, I have to look.
If you look at the middle of the first page, under History of Present Illness, do you see where it says tolerate Cymbalta 30 milligrams daily well?
Yes.
Is that from
Yeah, I think it carried over.
So you think that was just something you forgot to update?
Possibly.
Well, if you updated it, should it have said 30 or 60?
I don't remember.
So you don't
She
recall?
was instructed to take more.
I'm sorry?
She was instructed to increase the dose. Whether she did or not, I don't remember.
Okay. If she said she was only taking 30 instead of the 60 that you recommended, would you have made a note in your progress reports about that?
Possibly.
Would that be an important fact for you to note?
Probably.
So having said that, does that cause you to believe that it's simply that you didn't update the report from the second visit?
No, I'm not sure whether she increased it or not. I'm not sure.
Did you ask her?
I don't remember.
And your notes don't, you're unsure?
They don't reflect.
Let me finish my question. With the way you type, with the way you take your progress notes, you're unsure whether, in fact, she had increased her dosage or she didn't.
Yes.
Under where it says stress at home, moving out of the house, can't afford, is that something she told you during her third visit, or did you just fail to take that out from the second visit?
It was within a few weeks. That hasn't changed, but I think it carried over from the second visit.
Okay. My question is then, you forgot to take it out from the second visit.
I think it was active as of that visit too, but she mentioned to me that for the first time at the second visit.
Okay, now on the third, this is the third visit, March 22nd. Did she tell you that she had stress at home, moving out of the house, can't afford?
Yes.
So she said the same thing on the third visit as she did on the second visit.
Yes.
This was not just a mistake, you left it in, correct?
I don't remember.
Could it have been a mistake?
It's possible that it got carried over from before.
In fact, everything under history of present illness all the way up to tolerating Cymbalta 30 milligrams daily well, stress at home, moving out of the house, can't afford, is the same in the second visit, correct?
Yes.
You hadn't reviewed the Cedars-Sinai files again since the second visit, correct?
No.
Okay. Now, do you see where it's underneath that sentence I read? there seems to be a notes taken,
To be a what taken, I'm sorry?
a series of notes taken with just phrases.
Yes.
That doesn't appear, I don't believe, in the second progress report in that format. Am I correct?
I think you're correct.
So that's something new you would have added? Is that someone's phone going off? Oh, okay.
No, it is in the first.
So ER treated with painkillers.
Yeah. In the first visit, it's there.
So this portion was carried over from the first visit, correct?
Possibly, yes.
Down at the bottom of the first page, patient reports improvement in pain with trigger point injections for 3 weeks now. Now she, what does that say?
She complains of Norco not being very effective as taking 2 pills every 6 hours.
Okay. So, do you recall her telling you that during her third session?
Yes,
What did you tell her about that?
that she's taking a lot of painkillers.
Is that too much in your opinion?
It's a lot.
Is it too much?
Too much for what? Vague.
She can answer.
I think she
It's
already
a
did.
lot. What the-
She already answered it, I think.
No, she didn't.
In your opinion, is taking 2 tablets every 6 hours too much for a patient?
Too much for pain control, for getting side effects, for what exactly?
For anything?
I can't say too much. It's very vague.
Well, when Tara told you she was taking 2 tablets every 6 hours, did you believe it was too much for any reason?
It was a lot of pain medication, yes.
Did you believe it was too much for any reason?
No.
Patient is very anxious, worried about post-operative pain, requesting pain medication. Do you see that?
Yes.
Okay. So, did Tara ask you for pain medication for her surgery?
She asked me for pain medication, period, before the surgery. She was in pain and she was out of medication.
And what did you tell her when she asked for pain medication?
That she should, I will give her some pain medications and she will have someone help her with post-operative pain after the surgery.
So you told her you would give her more medication?
Yes.
Did you tell her you were going to give her Norco?
Probably. I don't remember that.
You don't remember? Okay. Let's go back to the first page. And you see where it says current medications?
Yes.
Okay. Did you put that in there?
Probably.
Who would have put it in there if you didn't put it in there?
Most of the time I do. Occasionally MAs do, but most of the time the doctor.
Usually MAs do?
And for the record, what does that stand for?
Medical assistant?
So, do you believe that you would have listed her current medications based on the bottles that she brought with her to show you?
Yes.
And so she showed you Klonopin, correct?
I don't remember seeing every single medication, but yes, I think so.
And it would have shown the dosage as well as the treating physician, correct?
Yes.
Same for Norco.
Yes.
Same for Synthroid.
Yes.
Now it says Cymbalta 30 milligrams, capsule twice a day. Did you just carry that over from the second visit?
I believe so.
So you're not sure if whether it was actually 60 milligrams?
I'm not sure.
Okay. And what does it say underneath it?
Trazodone.
In diet, keep reading.
I can't really read that. 50 milligrams as directed.
Does it say trazodone and diet manage product? 50 milligrams is directed?
Yes.
So were you giving her medication for weight loss?
No.
So what is this medication for?
Trazodone is for sleep.
So it's to help her sleep?
Yes.
Okay. Was she no longer, were you strike that, were you prescribing her Ambien at all?
I don't believe so.
Do you know if she was receiving, strike that, why did you switch from Ambien to trazodone for her?
I don't think I switched.
Well, she was taking Ambien before, correct?
Yes, but I did not give her prescription for Ambien or
Correct.
don't recall giving her prescription for trazodone.
Oh, you don't believe you did?
I don't.
Okay.
I don't remember.
Did you ask her who gave her the prescription for trazodone?
I don't remember.
Okay, what's the next prescription?
Strattera.
What is that?
I don't recall that.
You're not sure what that is?
No.
40 milligrams, 1 capsule every morning, once a day. Do
I
you
remember.
know who prescribed that for her?
No.
If she told you she was taking that and you didn't know what it was, what would you do?
I would ask her. I don't recall that at all.
What is the next prescription?
Levothyroxine.
And what is that?
Levothyroxine
I'm sorry. And what is that for?
for thyroid.
And did you prescribe that for her?
I don't think so.
Do you know who did?
No.
And the last one is what?
Cytomel
And what is that for?
for thyroid also.
Okay. Is this a good time?
This is the end of videotape number 2. We're going off the record. The time is 3:15.